Well, welcome to another episode of Joint Talk with myself, Dr. John Stelmach and Shanna Moyer. Today, a topic that we deal with after surgery, but we have to start it before. And that's some of the things that you'll need for your replacement surgery to help you. Now we're going to talk about some of the items that we have available here at the office. Now, certainly none of these things are absolutely required, but we're trying to make it easy for you after surgery. And we'll go over a few things. And Shanna often will talk to you about what's available. So we'll get started. So the first thing after surgery, swelling is a big problem after surgery because it's a big operation, and I've found that swelling is our enemy. So we do a lot of things in the operating room in order to try to prevent swelling, but afterwards at home, there are a few things that you can do. The most important thing is to realize you just had an operation and to kind of, when you go home, take it easy and rest a little bit. The temptation is we've numbed your knee up and you go home and think, oh, this is a piece of cake. I'm just gonna go out and fix my car, cut the grass or whatever, but it really is important to kind of rest and elevate your leg and ice it down. And that's real hard. Now, Shanna has a lot of things that we've kind of come up with to help with this. Now, we kind of have something we call the bundle, so what's included in that, Shanna? What
so
can we
in
do?
the surgery bundle, you get a Breg Polar Cube, which is a cold water therapy for your hip or your knee, and a elevation pillow that gets their leg up to the right degree for pain and swelling control, and vitamin D. So the 2 dosages of vitamin D. So do you want to tell them how important it is and the benefits of the vitamin D before surgery?
Yes, the vitamin D. Now it's a vitamin that's directly related to healing of the musculoskeletal system. It's been really shown that most people in Berks County are deficient in vitamin D. So there's no reason to not start taking it beforehand to give you a little jump start. Now it's, again, not make or break, but I always take all the help I can get. So vitamin D is given. Now, how do we order that, Shanna?
So they get 4 dosages of the 50,000 IUs, which is a lot of people say when we recommend vitamin D, I take vitamin D. Most people take 2,000. That's what I take every day. This is 50,000. So you're going to want to take 1 tablet once a week for 4 weeks, and then we give you the complimentary bottle of the 2,000 IUs that you like them to take once a day until the bottle's complete.
Right. So if you haven't been taking vitamin D, it's good to bolus you, what they say, to take a bunch of it in the beginning. Then you can go back to your regular dose. And I get some questions about, well, do I need to take that forever? And the answer is no. Once you're kind of through the operation, through the bottle, which is a big bottle, then you can just stop taking it. So we'll order to get you that beforehand.
Mm-hmm.
Well, now we're going to talk about the Breg Polar Cube. This is something that's really, really helpful and really comfortable for you after surgery. What it is, it's a way to have continuous ice and cold to your knee without really the risk of injuring yourself. You can certainly use an ice pack on your knee afterwards, but your knee or hip, it's kind of hard to keep an ice pack on because there's a thickness to it and it falls off. And really want to try to keep it as much ice on as we can. And you're going to use this device in any sort of ice thing for several weeks after. Now, as far as this goes, Shanna, how did they get this from where then? How does it work usually?
So usually you can stick anywhere from 4 to 6 frozen water bottles in. The hose attaches to the pad. You wrap the pad around the body part and it releases cold water continuous therapy.
So what happens is you open this front lid here that you would put the ice and water. Now patients put frozen water bottles.
Yep.
They have maybe like a case of frozen water. Yep. You keep putting new bottles in. As they melt, you take them out and put new ones in. You can keep them in there. That way you don't waste a lot of ice. It closes and locks so it's less likely to spill. Then what happens, this goes on and then clicks together. I don't know if guess you can see that there, that clicks together. And then this is the pad. Now this is a hip pad, I believe. The knee pad's a little bit different than that, but they're all the same idea. But the water flows through here. It's nice and thin so you can wrap it around, and it's a constant circulation because this is a insulated type hose. Now, can they get different pads sometimes?
Yep, so we sell the different pads for these. So if you ever decide that, or you need, this is a hip, that you need a total knee, or your husband or wife needs a total knee, friend or family, we sell the pads here in the office, so you can get great use out of this. We also have ankle pads for our ankle patients as well.
One thing patients ask me, they have a neighbor that had one of these, and that's fine, but please just make sure you get a new pad, because I'm not sure what your neighbor was in, but it's just important to be clean with this. This is a surgery that's sterile. Now, they pick this up, is it here at the office?
Yep, we always have them here in the office. So usually we'll discuss it when we're in the room picking your surgery date, and I meet with you in the office. If for some reason one of us doesn't have a chance to meet you in the office, we will go over it over the phone when we're scheduling your surgery and make arrangements for you to pick it up in the office before your surgery.
And like I say, this is something that you'll really use a lot in the beginning. It's very easy to keep on. And over time, as you're getting better, you don't need ice quite as often, but it's something that you'll really like. I know it's a little bit of an expense up front, and no, insurance doesn't pay for it. We used to be able to do that, but they don't pay for it. But it is helpful. The other thing that you can do, the patients kind of have a light go on and explain to them. In a few weeks, sometimes it's nice to put a little bit of warmth on the knee before you do your therapy to loosen it up. What happens is put some warm water in here, and then it does the same thing. Then afterwards, you can take that out, put cold water, and then you can put ice in there and ice your knee down. So it is kind of versatile, and don't throw it away. It's a very good thing. So these are available.
A lot of the physical therapy offices are using these, so patients are recognizing it, so they want it for their home.
Right.
Yeah.
It's something to use all the time.
Mm-hmm.
Okay, next item is elevation after surgery. It's important to keep your leg elevated. I know if I've injured my ankle, I grab a pillow off the bed and put my foot on it. Well, as you know, they squish down. They really don't elevate anything. A couch cushion is a good thing, but then you got to take your cushion off your couch to try to elevate your leg. So what we've done is Shanna has found this item right here, or at least it did.
Yep.
Somebody did, but anyway,
Somebody did, yep.
When they get it, now they get this again. Is it through the office here?
Yep, it's through the office. So what we do is each product you can buy individually, but what I've come up with is a surgery bundle. So we offer all of the items for a discounted price since you're purchasing it. So this retails for, I think, 50 or 75, I believe, don't quote me. And the Polar Cube, I think, retails for $250. So we give you the pillow, the Polar Cube, and both dosages of the vitamin D, so you don't have to go spend $20 on a whole bottle of 50,000 IUs when you only need 4 tablets for $275. So it's quite a deal.
Right. So you get this item through the office, and it comes like this,
Yep.
but then through the miracle of science, you unravel it, and then it comes out like this. Okay. So what this is a nice firm pillow, which you can see is wedge shape here. So you put this pointy part goes towards your head. You lie down, and your thigh goes up here, and your foot goes on here. And what this will then do, it'll keep your leg up in the air in a comfortable position. The other thing I fight a lot is that the therapists are telling me, oh, you can't keep your knee bent. You have to keep it straight eventually. But for the first few days, what we want to do is I want to keep the swelling out. So this is a way, it's nice and firm. It doesn't squish down. It keeps your leg up in the air. And again, you're going to use this for several weeks. You can save it, and certainly you can use it over time.
Yep.
And if you can figure out how to get it back in the bag, then you can put it back in the bag. But I don't think it's going back in the bag. But anyway, this is another item that we have. And again, these things are not covered by insurance, but boy, do they sure make you feel better when you get them. And I think it's worthwhile if you can afford it. Okay, so another item that we offer to you, one of the problems I hear about in the office at 3 weeks is, doctor, I just can't sleep. I'm up all night. Well, that's a lot of different things kind of adding up to not being able to sleep. A lot of it's from the pain pills, because you think you're sleeping with pain pills, but you're not really sleeping, so you're kind of drowsy. The other thing is you take a pain pill during the day, you get a little tired, you take a nap, and so at nighttime, you haven't really burned your energy off, so now you're awake in the middle of the night. So I hear that a lot, and I really don't like to prescribe prescription pain medicine like Ambien or something, because that's just what you need is another, addictive narcotic type medication. So we don't like to do that. So thing that's becoming quite popular nowadays are these peptides. Now, Shanna, what is this, what we have here?
So this is a combination of magnesium glycinate, citrate, taurate, L-theanine, and agapin. I don't know if I'm saying that right, but a lot of people I find are severely depleted of magnesium. And that can affect your sleep. Magnesium glycinate is great for sleep. These are all natural supplements. They're not going to interfere with a lot of your other medications. We always recommend you check with your family doctor before taking these, but our patients love these. I myself take a lot of this myself.
And these things are really, this is not a prescription medication. These are things that are called peptides. They're kind of getting very popular now. And again, it's the kind of thing you can go out and find. If you want to try to buy it, you can certainly go do that. But it just, it's something that we make available to you. You can try it. And a lot of times by 6 weeks after surgery, you're kind of over that. But people take these all the time. In fact, I take them too. And yeah, so.
And one of the things that's nice about this is there's no crazy side effects. Like I know with Ambien, people can have nightmares. Correct. Or it can become addictive. Yeah. You don't feel groggy like if you take like ZQuil and things like that, which really isn't good for you. There have been links to early dementia with that stuff. So this is all natural, and it's a really great alternative if you want to get a good night's sleep. Again,
we have that here in the office. It's just something else because that's a common question, but it helps you get through things. Well, the final thing, as you get to the end of your treatment. Now, after surgery, I'll see you in the hospital, and myself or Amanda, and then 3 weeks afterwards, I'll see you, and that's when we're going to use the pillow and the polar cube and the sleep aids and that sort of thing. But then at the end of that 6 weeks, the last visit, a lot of times your scar is still quite red and healing, and you have a little bit of soreness. So patients and everybody's a little concerned what the scar is going to look like, and a lot of that it's up to how your body heals. But we do have some things maybe to help you with that a little bit if you'd like. So Shannon, what do we have here?
So we have medical grade scar cream. It's a recovery gel that you can put on the affected area to minimize the redness and the visions of the scar. We sell the large tube for the bigger incisions and a small tube for the smaller incisions.
This is the kind of thing you can put on several times a day. It's basically a silicone-based a cream, and it's helpful. Certainly vitamin D cream and vitamin K, all that sort of stuff that you put on your favorite hand lotion. And really part of the healing process is time with the wound. But this sort of thing does help, and dermatologists use this. And this is, we talked to several dermatologists, and this kind of seemed to be the thing to do. And again, not necessary, but it's helpful. And we're trying to get your scar looking as good as we can. And at this point, hopefully you've learned a few things, and these things again are all available, and we hope you did well with your surgery, or good luck with everything, and we'll see you